Cardiovascular exercises are activities that raise your heart rate and keep it elevated. They're continuous, rhythmic, and dynamic in nature, such as brisk walking, cycling, swimming, jogging, dancing, or elliptical activity. The American College of Sports Medicine recommends doing cardio activities on most days of the week, and they also recommend accumulating at least 30 minutes on each of those days. The 30 minutes can be continuous, done all at once, or it can be intermittent, as long as the bouts are at least 10 minutes in duration. The physical activity guidelines for Americans recommend accumulating 150 minutes of moderate intensity activity per week, or 75 minutes of vigorous intensity activity per week. How do you know what intensity you're working at? There are a couple different easy methods to gauge intensity of cardio activities. The first one would be a target heart rate range. This is based on your age. First, you want to be able to find your heart rate. You can do this easily on the side of your neck or on your wrist. You'll count for 6 seconds, add a 0, and this will estimate your heart rate in beats per minute. If you're between the ages of 20 and 29, your heart rate should be between 140 and 170 beats per minute. In your 30s, it should be between 130 and 160 beats per minute. In your 40s, between 120 and 150 beats per minute. And 50 or above, between 110 and 140 beats per minute. Another way to gauge exercise intensity is the talk test. So if you were to be exercising next to someone else, you want to be able to carry on a brief conversation with them, but you should also feel slightly out of breath. So what are the benefits to be gained from cardio exercise, or basically why do we do it? Cardiovascular exercise increases cardiorespiratory fitness, which in turn decreases your overall mortality risk, meaning you're less likely to die from any cause if you're fit. It also decreases the likelihood of having a heart attack or stroke. It decreases the likelihood of developing chronic diseases such as type 2 diabetes, hypertension, high cholesterol, obesity, and breast and colon cancers. Concerning weight loss, cardio helps to burn calories or expend energy, so it's beneficial for losing weight and for maintaining a normal body weight. Cardio also increases your high-density lipoprotein, which is the good cholesterol that in turn helps to remove the bad cholesterol from the body. Cardio decreases certain psychological symptoms such as anxiety and depression, improves mood and overall quality of life. Finally, remember that these recommendations are the minimum requirements for health benefits, and there's something called a dose-response effect, whereby doing more cardio will produce more benefits. Some is better than none, and if you're new to exercise, please check out our FAQ page for tips on progression.